Hi everyone. In today's lecture, we will review Chapter 13. Chapter 13 highlights information systems. And we'll get started. All right, so to kick it off, we'll give you a brief background. The interrelationship between HIM and IT has grown steadily over the past decades. With the advent of the Electronic Master Patient Index, automated transcription systems, clinical data repositories, computer-assisted coding, federal regulations relating to electronic transmission of billing data, integrated patient care information systems, electronic data interchange, and the electronic health record, today's HIM professional must be intimately aware of IT and all that it offers to the HIM field. This chapter provides a basis for the HIM professional to gain an understanding of the legal issues that are present in IT, particularly those associated with the EHR as it relates to accreditation, licensure, and liability. HIM professionals have been working to transform the traditional paper-based patient record into an electronic health record for years. Over time, this transformation has been quite successful in a sizable number of healthcare facilities. For example, here in the Suffolk County, I would say about 95% of all hospitals across the county have moved to an electronic health record system. It's good because it improves the availability and accessibility of data. Going electronic saves space, and you don't have to worry about storing those old paper charts. And it increases the demand from external forces, including regulatory agencies, accrediting organizations, and insurance companies. It also avoids mistakes, reduces costs, and improves care. The legal health record. All right, so when we talk about the legal health record is defined as the legal business record that's generated at or for a healthcare organization. A patient's paper file contains more than just the health record. It may include correspondence, requests for release of information, and an electronic health record may be similar. However, it is complex in the fact that it includes master patient indexes, practice guidelines and prompts, and may not be part of the patient health record. Keep in mind that only a health record is to be produced in a claim that is brought to the full legal system. Every healthcare provider and organization should define the subset of the electronic system that can be called the patient's legal health record. This subset may vary from practice to practice because what is memorialized or captured in one healthcare setting may not be in another setting. As a general rule, data and documentation that are patient-specific, created or generated by the healthcare provider and memorialize the patient care delivered are considered the patient's legal health record in an electronic context. Data that serves as the source of the memorialization is generally not considered part of the legal health record, although it may be retrieved upon request. Similarly, administrative data, such as audit trails, and derived data, such as aggregate data, that's used to create accreditation or statistical reports, are not considered part of the legal health record. Licensing authorities and accredited organizations play a major role in the life of a healthcare provider. The state licensing authority authorizes the provider to practice in a particular state, and the accrediting organization sets standards for each provider's compliance. For this, it is important to understand the impact that these bodies have on healthcare providers transitioning to an electronic health record. Although the federal government has begun to address issues that concern electronic transmission of health information, there is still much work that remains to be done. Until such a time as the federal government completes its efforts on this issue, the standards and restrictions of licensing authorities and accrediting organizations will also govern how the transition to an electronic health record will take place. The American Recovery and Reinvestment Act redefines the electronic health record. The ARRA identified and defined by the federal government content of the electronic health record. They stated that an EHR is created, gathered, managed, and consulted by authorized healthcare providers and staff. It includes demographic and clinical information, and it may provide clinical support, including physician order entries and capture or query relevance to quality of care. It is also used to exchange and integrate electronic health information with other sources. The Institute of Medicine also has described core functions of electronic health record system. It includes health information and data, results management, effective communications, clinical decision support, order entry and management, patient support, reporting and population health management, and administrative processes. One of the first questions that an HIM professional should consider is whether the creation and storage of patient-specific information in an electronic medium is authorized by the state law or by appropriate licensing authority. A review of the applicable law reveals that either of the two answers may apply. The electronic health record may be expressly authorized, or that the statutes and regulations may be silent on the question. All entries that are recorded in a patient record must be authored and authenticated. As a review from Chapter 8, authorship identifies that a healthcare provider who has been made an entry in the record in writing by dictation, keyboard, or by keyless data entry. Authentication confirms the entry, either by written signature, initials, or computer-generated signature code. This confirmation implies that the entry as recorded is accurate. Such entries in the record must have been made contemporaneously with the occurrence of the event. Because of the nature of EHR, timeliness of the entry can be established automatically, as can the timeliness of any corrections or updates. For an electronic health record, authentication is represented by an electronic signature. Sometimes this is referred to as computer-generated signature code. Any statute or regulation that expressly authorizes the use of an electronic health record, such as those that we previously discussed, would permit authentication by electronic signature. On the other hand, a state statute or regulation that requires a physician's signature to authenticate a health record without expressly authorizing use of a computer key or code as an electronic signature leaves the question open to speculation. Where the statute or regulation is not clear, the licensing authority's interpretation of the statute or regulation will serve as the guide to proper authentication. Electronic signatures are also addressed by the Electronic Signatures and Global and National Commerce Act of 2001, e-sign. This act applies to the use of electronic signatures in international and national commerce. It states that electronic signatures may not serve as a legal bar to contracts or other records involved in interstate and foreign commerce. Courts have not yet interpreted this act to determine whether the transfer of health information to support reimbursement constitutes as interstate commerce. Assuming that such a determination is reached, the act would support authentication of entries made in the record by computer key. Accrediting bodies expressly recognizes authentication by computer methods. For example, the Medicare Conditions of Participation, Joint Commission, DNV, and Healthcare permit authentication of entries made in the record by computer. It then rests with the healthcare organization to utilize a software program that then establishes the electronic signature as unique to the author and to represent the authentication of that author in order to meet the accrediting standards. When we're discussing liability issues in the context of an electronic health record, it can be broken down into two categories. The first is liability issues for which the patient record serves as proof in a lawsuit involving the quality of patient care. The second is liability issues that have arisen from unauthorized access to or careless handling of patient information. For liability issues that involve patient record as proof in a lawsuit, the focus rests on whether the EHR may be properly admitted as evidence. For liability issues that involve access or handling of patient information, the focus rests on the legal requirement to keep the EHR safe and secure. Health records serve as the backbone of virtually every professional liability action. They are used to reconstruct an episode of patient care and establish whether the applicable standard of care was met. Other civil actions require the admissibility of health records, including credentialing and disciplinary proceedings of providers and other health professionals. In addition, health records may be used in criminal matters to establish the cause of the victim's death or an insanity defense. In each lawsuit in which the health record will be used to prove or disapprove a fact, the issue of admissibility of the health record is present. Admissibility concerns with pertinent and proper evidence that may be considered by the judge and or jury when deciding the issues in the lawsuit. As a general matter, health records are not admitted into evidence unless they overcome the hearsay rule. This rule prohibits the introduction into evidence of out-of-court statements that are offered to prove the truth of the matter asserted. This introduction into evidence is accomplished through the use of the business record exception to the hearsay rule or through a subset to that exception specifically governing health records. Under the business record exception, the party seeking to admit the health record must first meet the foundation requirements of the exception. A foundation is made by establishing that the record was made and kept in the ordinary course of business, at or near the time the event was recorded, and by a person with knowledge of the acts, events, conditions, opinions, and diagnoses appearing in it. After meeting these requirements, the party seeks to introduce the record must demonstrate the accuracy and trustworthiness of it. The party accomplishes these tasks by presenting the custodian of records as a witness to explain the record-keeping procedures. HIM professionals must be able to testify as to both the foundation and trustworthiness and accuracy requirements of the business record exception. In addition to that knowledge, that HIM professional must possess the paper-based system and knowledge of electronic medical system. First off, the HIM professional should be familiar with the manner in which the data are recorded. Second, the HIM professional should be familiar with both the hardware and software that's used in the system and the quality controls measures that are used to ensure the reliability and validity of the data and policy rules governing access to the system and how to make corrections to the record. Finally, HIM professionals must possess knowledge of the end product that the party is trying to admit into evidence. The use of a computer printout of an electronic health record as evidence of patient care in court has not been widely tested because of the small number of healthcare providers who have fully automated their patient records. As the number of healthcare providers using electronic health record grows, the computer printout as evidence of quality patient care should become widely accepted by courts. In an electronic context, security refers to the means to regulate access to and ensure preservation of data. With health information context, security is implicated through a disruption of the healthcare facility's computer system, an interruption or discontinuation of a telemedicine system, unauthorized access to patient's health record, or the destruction of patient information, among some examples. Such unauthorized access, destruction, or modification leads to privacy violations, particularly a breach of confidentiality. The security of computer systems is only as good as the measures that are taken to safeguard the system. Some measures often taken in the context of computer systems include permissioning, encryption, damage prevention, and disaster recovery. The security of a patient record is important. Healthcare providers are charged under the Medicare Conditions of Participation and the standards of the Joint Commission and most other state licensing laws with the responsibility to safeguard patient information. Healthcare providers are also charged under HIPAA as well as ARRA with following security and privacy regulations issued by the Department of Health and Human Services. The Code of Ethics of virtually all healthcare professions address the requirements to safeguard patient information. The breach of any of these responsibilities may result in legal liability, including claims of breach of confidentiality, invasion of privacy, defamation, or negligence. All may result from unauthorized access to or careless handling of patient information. A healthcare provider may be sanctioned by their professional association for not adhering to the Code of Ethics. As the HIM manager or director may imagine, physical security concerns the physical protection of the nuts and bolts of the computer system and the health record. Physical security is best illustrated by a series of questions, including what protections from the physical environment are in place? Do the protections include temperature and humidity controls, power surge and failure protection devices? Are fire alarms installed and magnetic media used for storage secured in a fireproof location? Are there rules that limit access to computer terminals and storage areas? Are terminals bolted to desks and disks stored in locked cabinets to prevent theft? Are maintenance requirements documented and maintenance logs maintained? These are a handful of questions that must be addressed to ensure the physical security of the electronic health record. Personnel security focuses on the human aspect of security. In addition to the normal reference check that is associated with hiring personnel, a healthcare provider may wish to consider the following for personnel hired to work with the electronic health record. This includes screening for past criminal history, work-related security problems, or a high school or college record of computer hacking. Once hired, the provider should then educate the employee about the provider's confidentiality policy and the employee's responsibility to keep data confidential. Further education should address how to access the computer system properly, the limits on access to information, and the consequences for violating the provider's policy. Risk prevention techniques merge physical and personnel security concepts. Risk prevention techniques serve to protect the integrity and confidentiality of the data at issue. Below is the prevention techniques that are listed. It includes protect integrity and confidentiality of data by doing so by restricting access, determining who has access and for what purpose, computer passwords, keycards, ID, restricting copy functions, security mechanisms in contracts with vendors, confidentiality agreements within networks, addressing the potential for computer sabotage, and safeguarding the use of laptop computers and personal digital assistants. Both HIPAA and ARRA addresses the obligation to safeguard PHI. Any contract with business associates are to include confidential nature of data, mechanisms used to safeguard data, and an indemnification of improper disclosure. It's also important to safeguard portable computers, prevent computer sabotage, and establish confidentiality agreements with network participants. The HIPAA security rule establishes security safeguards for PHI that a covered entity creates, receives, maintains, or transmits in an electronic form. The rule establishes that security safeguards protect the confidentiality of data so that only those individuals authorized may see the data. It ensures data integrity by protecting it from unauthorized creation, modification, or deletion, and it allows data to be available when it's needed. There are 17 different security standards that currently exist. These standards specify the use of integrity controls and encryption technology when transmitting electronic protected health information. Information access management techniques such as authorization, establishment, and modification of access privileges, workforce security standards such as clearance checks of personnel and termination procedures, and access controls such as automatic log-off and emergency access procedures. The essence of administrative safeguards under HIPAA is to help covered entities take actions and create policies and procedures to manage the development, implementation, and maintenance of security measures to protect personally identifiable health information. These actions, policies, and procedures should be designed to assist the covered entity in preventing, detecting, containing, and correcting security violations. Each covered entity is required to perform a risk assessment of its security practices, which should identify the way PHI in an electronic format is accessed and any potential vulnerabilities of that information. The essence of physical safeguards under HIPAA is to help covered entities protect their electronic information systems and related building and equipment from unauthorized intrusions and natural and environmental hazards. This focus on systems, facilities, and equipment addresses security from a macro level, and it's different from the administrative safeguards, which addresses security from a micro level. Examples of activities a covered entity may engage in to comply with physical safeguards include establishing access levels to physical space based on a person's role or function, ensuring that workstations are properly secure, establishing disposal policies and procedures for disks, tapes, storage devices, and other equipment, and establishing regular backup routines. The essence of technical safeguards under HIPAA is to help covered entities employ technological solutions to secure electronic PHI. This focus on technology should assist the covered entity in limiting unauthorized access and ensuring data integrity. Examples of activities a covered entity may engage in to comply with the technical safeguards include employing encryption technology with its electronic mail system, examining activity occurring on its computer networks, assigning unique identifiers to end users as a way to identify and track their use of electronic information systems, and employing account validation or password identification schemes to authenticate a user's identity. Encryption that is employed to protect ePHI should be of a sufficient strength algorithm so that ePHI is unusable, unreadable, or indecipherable to unauthorized individuals. The HIPAA security rule also addresses training requirements for staff with concerns around vulnerability of PHI in a covered entity's possession and the procedures to be followed to protect the information. Woven throughout the security rule is also the requirement that a covered entity establish an effective information security policy. Information security policies are the policies that define the framework around which an information security program is managed. These policies answer the who, what, when, where, why, and how questions of information security. In general, the relationship between HIPAA security versus the HIPAA privacy rule is more of a symbiotic relationship in their protection of personally identifiable health information. Both rules employ similar technology, they parallel treatment of business associates, and the three major safeguards. The HIPAA privacy rule serves to protect health information by providing patients with more control over their own information through safeguards and limitations that are imposed upon covered entities. The HIPAA security rule serves to protect the same information by specifying the technical requirements, policies, and procedures that covered entities can use to protect data from known threats and vulnerabilities. Although both rules proceed from different angles, they both serve the ultimate goal of protecting data from unauthorized uses and disclosures. The security rule also mirrors the privacy rule in the way that it assigns responsibility for compliance with HIPAA's mandated security directives to an individual within the covered entity. A security officer is tasked with the responsibility of developing and implementing information security policies, procedures, and technology systems required under the rule to maintain the confidentiality, integrity, and availability of both protected health information and the organization's healthcare information system. A breach is defined as the acquisition, access, use, or disclosure of PHI in a manner which compromises the security or privacy of PHI. This definition applies to all breaches, whether occurring with a covered entity or a business associate. In the event a covered entity learns of a breach or repeated breaches, the rule requires the provider to engage in a risk assessment of the situation. The risk assessment focuses on the probability of whether PHI has been compromised. There are four main factors that are considered in the assessment, which includes the nature and extent of the PHI involved, including the types of identifiers and the likelihood of re-identification, the unauthorized person who used the PHI or to whom the disclosure was made, whether the PHI was actually acquired or viewed, and the extent to which the risk to PHI has been mitigated. Where the probability that PHI has been compromised through the risk assessment is low, a notification of the breach will not be necessary. However, if the probability is higher, notification of the breach is required under the rule. The use of the internet in healthcare fields is viewed from more than one perspective. Healthcare providers may visit websites throughout the day to obtain information to deliver better patient care by reviewing the latest healthcare news, accessing libraries of data and clinical alerts, and scheduling continuing education, as well as researching Poison Control Center databases and the results of clinical studies. At the same time, patients may also visit websites to seek answers to their healthcare needs by researching their conditions, registering for clinical trials, and learning about prescriptions, scheduled participation in screening programs, and purchasing durable medical equipment. In addition, some organizations actively engage in electronic health practices known as e-health in order to exchange health information between the patient and the provider. These entities are known as e-health organizations and are defined as organizations that collect and display individually identifiable health information over the internet. Patients who participate in e-health are known as e-health consumers, and they're defined as individuals whose individually identifiable health information is collected, maintained, or displayed over the internet. Email is one of the most popular modes of communication in the U.S. Email, of course, is a form of communication between parties or individuals using only electronic means. As with private industry, the healthcare field has incorporated email into its business practices. healthcare organizations use email that contain patient-specific health information, and they should be careful to consider security precautions as part of their business practices. Similar to email, the use of text messaging in healthcare environment has exploded in the last 15 years. Text messaging refers to the short electronic messages that are sent between cell phones from one cell to another or by fixed portable devices. It is often used as a substitute for voice calls, either from convenience or because voice communication is impossible or undesirable. Laws and regulations on privacy of health information apply between emails and text message, as PHI is gone back and forth. There is a plan for security measures to address patient confidentiality, instructions on permissible content and the sensitivity of information, and encryption of algorithms when we're referring to electronic mail and text messaging. A form of technology that has the potential to save a lot of money for healthcare organizations is digital imaging. Digital imaging permits a paper document to be scanned on a device that works similarly to a photocopier. The image is then saved to an optical disc or a CD or magnetic tape, and after electronic indexing can be viewed through a server or a website. The image is then available to multiple users who need to access the data that's contained in the images. Now, there are many different advantages and disadvantages of digital imaging systems. Unlike e-health and email, some states have enacted laws and regulations that deal directly with digital imaging. These laws and regulations generally address digital imaging in the context of storage media for health information. In addition, digital imaging is subject to the same principles that are addressed in federal and state regulations that govern confidentiality, record retention, and security of patient-specific information. Another area of technology that has expanded the means of medical practice is the use of telemedicine. Telemedicine is the use of electronic communications and information technologies to provide or support clinical care at a distance. Telemedicine is often used in remote areas where access to healthcare professionals may be limited. Telemedicine serves to connect patients with a healthcare provider through the use of multimedia communications and information systems. The connection permits professionals to diagnose, treat, and monitor patients. Telemedicine technologies can include facsimile, audio capabilities including radio and telephone, still images, full motion video, and color screens to facilitate face-to-face contact. Telemedicine offers the opportunity for tremendous benefits to both patients and healthcare providers. One of the reasons the field of telemedicine has not advanced more rapidly is due to the unresolved questions of which a state's law applies to such issues as privacy, licensing, and medical reimbursement. At this time, we have completed Chapter 13's discussion on information systems. I encourage everyone to take the time to review this chapter in detail and reach out if you have any questions, and I will assist. Have a great day.